Fetal hydronephrosis refers to the dilatation of renal pelvis, which occurs when there is impaired drainage of urine from the kidney. This condition is one of the most common anomalies detected during prenatal ultrasounds and can vary in severity. It can range from a mild and transient condition that resolves on its own to more severe cases that may require further investigation and management. The degree of dilatation and whether it affects one or both kidneys can provide important clues regarding the underlying cause and potential complications. While many cases are mild and resolve without intervention, it is essential to monitor the condition closely throughout pregnancy to ensure the best outcome for both the fetus and the mother. Fetal hydronephrosis can be caused by a variety of conditions, which are classified into obstructive and non-obstructive causes. Obstructive causes, our first one is ureteropelvic junction obstruction. Uh, this occurs when there is a blockage at the junction of the renal pelvis and the ureter, preventing normal urine flow from the kidneys. Posterior urethral valve, or PUV, is seen primarily in male fetuses. This condition causes blockage in the urethra, leading to urine buildup in the bladder and kidneys. Ureterovesical junction obstruction. This blockage occurs where the ureter enters the bladder, hindering the normal flow of urine. Non-obstructive causes, vesicoureteral reflux. This condition involves the backflow of urine from the bladder into the ureter and kidneys, which can lead to renal pelvis dilatation and hydronephrosis. Hydronephrosis as well can be a transient hydronephrosis, which is temporary and often mild dilatation of the renal pelvis that typically resolves on its own as pregnancy progresses. Understanding the cause of hydronephrosis is critical for determining the appropriate management uh, and monitoring strategies during pregnancy. Ultrasound plays a crucial role in diagnosing and assessing fetal hydronephrosis. Both 3D and 4D imaging provide valuable insights into the renal anatomy and function. 3D ultrasound with high resolution imaging capabilities. 3D ultrasound provides a detailed and enhanced view of the renal anatomy, allowing for a more accurate assessment of the renal pelvis and the ureters. This allows us to determine the extent of dilatation and identify any structural abnormalities. 4D ultrasound with the real-time imaging capabilities enables us and to dynamically observe renal and bladder functions. It provides insights into the flow of urine and helps us assess any obstruction that may be present. By visualizing the movements and the changes in the fetal kidneys and bladder, 4D ultrasound can aid in distinction between obstructive and non-obstructive causes of hydronephrosis. Using these advanced ultrasound techniques allows us to monitor the condition more closely and plan for the appropriate follow-up and management. Let's take a look at some additional findings that can help us evaluate the severity of fetal hydronephrosis. In more severe cases of hydronephrosis, we may observe cortical thinning. This occurs as a result of prolonged obstruction where the kidneys tissue itself begins to lose its normal structure. Cortical thinning is a sign of significant damage to the kidney and may indicate a poor prognosis if not addressed immediately. It is essential to evaluate the bladder, especially in cases where obstruction is suspected. Posterior urethral valve, which is a common cause of obstructive hydronephrosis, may cause a distinctive keyhole sign. This is seen when there is a distended bladder and a dilated posterior urethra. The keyhole appearance is a classic ultrasound finding in male fetuses with POV, and it warrants further investigation and management. Amniotic fluid levels are important consideration. In cases of obstructive hydronephrosis, we may see polyhydramnios if the fetus is unable to properly swallow and absorb the fluid due to renal dysfunction. On the other hand, oligohydramnios, which is more common, can occur if there is significant renal failure or compromised kidney function. These findings help us assess the severity of the condition and guide our management decisions. So it is crucial to keep an eye on both structural and functional aspects of the renal system. Important associated anomalies that can be found in cases of hydronephrosis. In some cases of isolated mild hydronephrosis, particularly when there are no other obvious structural issues, it is essential to consider the possibility of chromosomal abnormalities. For instance, trisomy 21 can be associated with mild hydronephrosis or Pyelectasis. Through the hydronephrosis itself, though hydronephrosis itself might not be severe, it is crucial to assess for other signs of chromosomal syndromes in these cases, as early intervention and counseling are often required. Next, we have to look out for more complex syndromic associations. Bladder syndrome, for example, is a condition often characterized by posterior urethral valves, which leads to severe hydronephrosis. The syndrome also presents with a distinctive lack of abdominal musculature, hence the prone appearance. This is not an easy diagnosis to make, but it is crucial in understanding the scope of the condition. On the other hand, renal agenesis can sometimes be present on the contralateral side, with one kidney being severely affected and other absent altogether. These associations remind us that hydronephrosis isn't always an isolated anomaly. It may be a part of a broader developmental issue that requires a more comprehensive approach. So while mild hydronephrosis may seem relatively benign, a thorough investigation of associated anomalies is critical. After all, it's always better to be thorough than to find yourself in a hydronephrotic situation later on. Slide we will focus on how to differentiate fetal hydronephrosis from other renal anomalies that can present with similar findings on ultrasound. Multicystic kidney disease is a condition where the kidney appears enlarged and contains multiple non-communicating cysts. Unlike hydronephrosis, where the dilatation of the renal pelvis are observed, in multicystic dysplastic kidneys disease, the cysts do not communicate with each other or with the renal pelvis. This lack of communication is a key feature that helps distinguish MCDK from hydronephrosis. In polycystic kidney disease, the kidneys are typically enlarged and appear hyperechoic on ultrasound due to the presence of uniformly distributed microcysts. Unlike the large, well-defined cysts of MCDK, these cysts are not visible as discrete entities on ultrasound. Uh, Polycystic kidney disease can be more challenging to differentiate because the kidneys can appear normal in early gestation, but as the disease progresses, the kidneys enlarge and the echogenicity increases. Lastly, renal agenesis refers to the absence of one kidney. In this condition, there is no visible renal tissue on ultrasound, and the compensatory hypertrophy of the contralateral kidney may be observed. If the baby has only one kidney, the remaining kidney will often enlarge to compensate for the loss of function. In this case, there will be no signs of hydronephrosis because the remaining kidney is functioning normally, but the overall anatomy will be different from that seen in hydronephrosis. By distinguishing these conditions, you can be better prepared to identify the correct diagnosis and manage the care accordingly. Understanding these differences is critical for accurate prenatal counseling and planning. In this slide, we will discuss the management strategies and prognosis for fetal hydronephrosis. Regular serial ultrasounds are essential in tracking the progression of hydronephrosis. These ultrasounds help monitor the dilatation of the renal pelvis, renal parenchymal integrity, and amniotic fluid levels. It is particularly important to evaluate whether the dilatation is stable or worsening, as this can help predict potential complications after birth. Additionally, monitoring amniotic fluid levels can provide variable insight, as severe hydronephrosis might be linked to changes in fluid paths. Regarding postnatal evaluation after birth, a thorough evaluation is necessary. The first step is often by ultrasound, which is used to confirm the diagnosis and further assess the kidneys. Avoiding cystourethrogram may be performed to check for vesicoureteral reflux or any other potential obstructions in the urinary tract. This test is crucial in assessing whether urine is flowing backward from the bladder into the kidneys, which can worsen the condition if not addressed. Additionally, renal function tests are important to gauge how well the kidneys are performing and whether there is any impact on overall kidney health. Surgical intervention is often required in cases of significant obstruction, such as ureteropelvic junction obstruction or posterior urethral valves. These conditions might cause irreversible kidney damage if not treated promptly, and surgery is needed to restore normal urinary flow. Surgical options depend on the type and severity of the obstruction and may involve procedures like pyeloplasty, or valve ablation. Prognosis for mild hydronephrosis. The prognosis is generally favorable, and many cases resolve spontaneously without any long-term effects. In fact, transient or mild hydronephrosis, especially when detected early, tends to improve as the fetus matures or after birth. However, in cases of severe hydronephrosis, particularly with bilateral involvement or associated anomalies, the prognosis becomes more complicated. Severe cases can lead to impaired renal function or even pulmonary hypoplasia, a condition where the underdeveloped lungs fail to expand properly due to severe oligohydramnios. These severe cases may require more intensive management and interventions postnatally.